Good day, my name is Professor Dr. Bankole Johnson, and welcome to my talk today at ISAM. I hope everyone is doing very well. I'm sorry I can't be there, but I'm pleased to be able to provide my presentation in video format. Today I'm going to talk about the foundational evidence for ondansetron, or ADO4 in the compounded name, as a treatment for alcohol use disorder. And later on, my colleague, Professor Adial, is going to provide evidence and the exciting results of our phase 3 trial. Serotonin 3 receptors are found everywhere in the brain, but importantly, they're found in the corticomesolimbic system. The slide you're looking at shows a schematic that I drew up showing the close relationship between 5-HT3 receptors and dopamine neurons. In fact, 5-HT3 antagonists inhibit the release of dopamine, and as all of you know, dopamine is very important for the expression of the rewarding effects of alcohol use disorder. Alcohol use disorder is a moderately inheritable disease. About 50 to 60% of AUD is inherited, which means that the biological basis for developing biological treatments is actually very strong indeed. The key to precision medicine is being able to provide the right medicine at the right time for the right amount of time. Precision medicine allows us to identify specific genotypes that are associated with the treatment effect of ondansetron and then provide it to individuals for maximum clinical and therapeutic benefit. The foundational evidence for the efficacy of ADO4 in the treatment of alcohol use disorder spans approximately 2 decades. It begins with the studies of Ed Sellers, who show that individuals who drank less than 10 drinks per drinking day had a therapeutic effect to ondansetron. It was then followed up by several studies, and I'm going to show you part of our phase 2 study that we did a while ago. But these studies show that certain genotypes, particularly those that are associated with the long form of the serotonin transporter gene, are associated with decreased craving once ondansetron is given. There are also biochemical effects of ondansetron to change the binding capacity at the 5-HT3 receptor. Finally, we understand that studies that have been done in alcohol use dependence, which have used doses greater than our target dose of 4 micrograms per kilogram, has actually resulted in increased drinking rather than reduced drinking. This slide points to our study that was done a while ago now, looking at the effects of ADO4 in individuals who differ on serotonin transporter polymorphisms and 5-HT3A/B polymorphisms. In that clinical trial, we enrolled 283 alcohol-dependent individuals, and we provided ondansetron along with cognitive behavioral therapy for 12 weeks. The individuals were randomized a priori by our selected genotypes, and so this offered the first prospective genotypic study for the treatment of the effects of ondansetron on alcohol use disorder. The study was 11 weeks long, and the next slide shows you the results. The slides show that irrespective of whatever criterion you're using, whether it be drinks per drinking day, percentage of heavy drinking days, or percentage of days abstinent, that there is a significant clinical effect on the targeted genotypes of ADO4 to decrease consummatory behavior and to increase abstinence. An important facet of what we were also looking at is that ondansetron doesn't bind to the receptor, it actually binds to the 5-HT3A receptor. Well, we know that the 5-HT3A receptor and the B receptor form heterodimers for fast ion conductance. Therefore, it was important to segregate based upon also examining the effects of ondansetron on different 5-HT3 and B polymorphisms. I'll go on to add that these subtypes of the 5-HT3A and B receptor lie on chromosome 11. And here are the results. Looking at just the 5-HT3A/B receptor subtypes in our targeted genotypic population, again you see a very significant effect of ADO4 to decrease various consummatory behaviors associated with drinking and to increase abstinence. In fact, these are quite remarkable results given the large effect size. Basically, this slide shows that individuals who received ADO4 who had the targeted genotypes at the 5-HT3A and B receptors had approximately 11 to 12% less drinks per drinking day and heavy drinking days, and an increase in abstinence associated with the treatment. This genotype comprises approximately 34% of the population of all individuals who have alcohol use disorder. So one of the questions you might ask is, what if we combine the 5-HT3A/B polymorphisms and the polymorphisms at the LL and TT transporter gene? And so here you can see that the effect is still significant, although less, but again, you find a powerful effect of ondansetron with this genotypic panel that we came to put together. The next slide is a slide which shows the GMDR analysis of the 5-HT3A/B polymorphisms to validate that the effects that we are seeing are related to significant effects of ondansetron to modulate the drinking behavior of individuals who have that particular subtype. The next slide shows that we were able to come up with a selection of 5 genotypes that we were then able to use in our phase 3 trial, which is going to be presented by Professor Anu Alho. In summary, the foundational evidence I've shown you provides evidence from biochemical studies, studies that we've done on craving, and also our phase 2 results showing that ondansetron at the dose of 4 micrograms per kilogram in these selected genotypes of 5-HT3A/B polymorphisms and LLT polymorphisms is associated with a positive treatment response to decrease consummatory behaviors to alcohol in individuals with alcohol use dependence and to increase their abstinence. So the final point I'm going to make is that we've now located that there might be, even within this, a smaller subset of individuals who drink less than 10 drinks per drinking day who would be particularly responsive to ondansetron treatment. Thank you for listening to my presentation, and have a super meeting.